want to welcome everyone here. There's a wonderful mix of people in the room today, specialists, researchers, academics, experts, insurance professionals, corporate stakeholders, and of course the passionate and dedicated staff at Remedy Healthcare.
It really does feel like a bit of my baby, this one, bringing it along today. So, because it's the culmination of quite a long journey, searching and then leading the implementation of a program that we believe starts to fill the gap. And it's a large gap in services for people who are in a mental health facility and their general practice suffering from anxiety and depression. So Australian Unity established Remedy Healthcare in 2008 to try and fill the gaps that we were seeing that our members were experiencing in chronic diseases and in mental health. So people are finding themselves in a mental health facility all too often because there is this big gap between seeing your GP and ending up in a mental health facility. I was personally very shocked. I've been in this business for 9 years to learn about the frequency with which people are being admitted into an acute hospital. This is, these are people in this room. It's not an abnormal case with a mental health condition. And it's a sad fact that those who are admitted with clinical depression and anxiety are staying on average from a private health, and this is across the industry, it's not just our fund, an average of 20 days in acute care.
We're in every state and territory of Australia virtually, and what we're actually doing on behalf of insurers, corporates, the aged care sector, the public hospital sector, is providing nursing, care coordination, health coaching, and a whole range of services that are fully integrated. So I would say, now more than ever, Remedy is a business for everybody.
The main reason I'm here is, apart from being a diver, I'm also a men's health ambassador and a mental health ambassador.
The coaches, which we now call the low intensity coaches providing the service, telephone-based, evidence-based, but a really critical conceptual difference, guided self-help as opposed to therapy. So part of the aim of this is to attract people into a mental health service without stigmatising, without labelling, and being anonymous that you're talking to people over the phone.
In my particular fund, over the last 3 years, we've had a 60% increase in members accessing in-hospital treatment programs. And all of that has come from the extended family members of my fund, not from those who've served in the Defence Force or their immediate family. So this is a community issue. And what we find that we're very attracted to in this particular program, as we've been monitoring that trend and then seeing the success of treatment programs in hospitals, we've noticed that those who do really well, those members that do really well, they've been able to participate in a program, a local program, where they're supported after their hospital treatment. And we don't get that nationally. We get it in some isolated locations. And we need a program that supports people in recovery that can be delivered nationally. And that's what MindStep ticks all the boxes.
But, from day one, it was very pleasantly surprising how much people are willing to open up to you and really deliver a very similar, if not, I'd say sometimes better service over the phone. I think not being able to see the person you're talking to might help people to open up a bit more in some particularly sensitive areas and really get some great outcomes with people.
I naively thought that I was fixed. I don't know why, but I thought that I'd had my period of depression and that you only suffered from depression once in your life and then you move on. What I learnt was, after all of the adulation and the high of the Olympics wore off, I learned that depression doesn't just go away unless you actually address it, unless you actually come to understand what the underlying causes of your depression was. And unless you do that, it just lies dormant, waiting for another opportunity to present itself. But the reason why I speak about my experiences so candidly is because I think there are not enough good role models in the world. And what I believe a role model is not someone who never makes mistakes, because frankly that's really unrealistic. My idea of a role model is someone who makes mistakes but who learns from them and evolves from them and becomes a better person from them. And so that's why I do share my experiences about such taboo subjects like mental health and depression, anxiety and substance abuse. And because I believe that the more that I speak about it, the more that we all speak about it, the more it will start to break down the stigma and the shame that prevented me from reaching out to wonderful services like this when I was a teenager. So that's why I do it. Thank you.